everyone, this is Shelby Stanfield and I'm going to be showing you my larynx model today. I'm going to start by showing you the cartilages. So the first cartilage that I'm going to start with are the arytenoid cartilages, which are shown with this green foam. The arytenoid cartilages serve as the connection point for the vocal folds, and they allow for the abduction and adduction of the vocal folds. They rock and glide and sit on top of the cricoid cartilage. They also have a muscle process and a vocal process. The next cartilage I'm going to show you is the thyroid cartilage, which is depicted by this blue foam. And you can see it has the superior and inferior horns and the thyroid notch, which is also known as the Adam's apple on men. The purpose of this cartilage is to serve as the primary support for the vocal folds, and it protects the vocal folds as well. The next cartilage is the cricoid cartilage, and it wraps all the way around and forms the signet ring, as it's also known as. And the purpose of this cartilage is that it supports the thyroid and arytenoid cartilages, and the arytenoids sit on top of the cricoid cartilage at the cricoid facet, so where they attach. Back here is this is the red foam. This is depicting the epiglottis, and the main function of the epiglottis is that it is responsible for the protection of the airway during swallowing. So whenever we swallow, it flaps forward, and it is attached to the anterior surface of the thyroid cartilage. It also serves as the area of attachment for the aryepiglottic folds, which are depicted by this pink pipe cleaner right here. I also have this little blue pipe cleaners. They are the cuneiform cartilages, which sit on top of the aryepiglottic folds, but they do not serve a function. The next cartilage is, you can see right here, is this gold sparkly piece of foam. It is depicting the corniculate cartilages. They sit on top of the arytenoid cartilages, but they do not serve a function as well. And lastly of the cartilages, I'm going to show you the first tracheal ring. This supports the trachea, and it is shown by this silver sparkly foam. And then for my trachea, I used a Pringles can, and the trachea is the airway and the path to the lungs. So now I'm going to show you the bone. So we have the hyoid bone up here. It's depicted by this white piece of foam. The hyoid bone suspends the larynx and supports the tongue base. And then now I'm going to show you the muscles. So in here we can see this lime green yarn going from the arytenoid to the thyroid cartilages. This is the thyroarytenoid muscle. This muscle is responsible for phonation. It stiffens the vocal folds and contributes to pitch. The next muscle I'm going to show you are these pinks, this hot pink swirly muscle right here. It is the posterior cricoarytenoid muscle. It pulls back and down on the muscle processes to abduct the vocal folds. This red yarn right here that goes from the arytenoid to the cricoid is the lateral cricoarytenoid muscle. It helps adduct the arytenoids. They pull the vocal processes to the midline, which creates medial compression, which, as we all know, is needed for phonation. This orange yarn going from each arytenoid is depicting the transverse or inner arytenoid muscle. This muscle is responsible for pulling the posterior edges of the arytenoid cartilages together during adduction. The next muscle is this yellow yarn right here, and it makes an X, and it is supposed to depict the oblique inner arytenoid muscles. This muscle creates, it allows for the posterior edges of the arytenoids to come together during adduction as well. And back here, you can't really see it that great, but this is, and you can kind of see it right here, but this purple yarn depicts the cricothyroid muscle. This muscle is responsible for decreasing the space between the cricoid and thyroid cartilages to lengthen the vocal folds, which can either increase or decrease pitch. This gold sparkly foam that we have right here depicts the cricothyroid joint, and this is the connection point for the cricoid and thyroid cartilages. And now I'm going to show you the membranes, and I apologize that my membrane goes down a little far. I got a little crazy with the hot glue gun. This seafoam blue felt right here is depicting the thyrohyoid membrane, and then the pink that we have along the bottom is the cricothyroid membrane. And now I'm going to show you the nerves. So this lime green pipe cleaner right here depicts the superior laryngeal nerve, and this nerve is responsible for innervating the cricothyroid muscle. And then this orange pipe cleaner depicts the recurrent laryngeal nerve, which is responsible for innervation of the thyroarytenoid muscle, the interarytenoids, the lateral cricoarytenoids, and the posterior cricoarytenoid muscles. So now that we've done all of the anatomy stuff, I'm going to move on to your physiology questions. And the first one was about respiration and how it relates to voice production. So when we inhale, the diaphragm, which would be down here, would contract and move down, and the ribs would expand, which allows for the volume of the lungs to increase. And the increase in volume allows for the pressure inside the lungs to decrease. So at this time, the vocal folds are adducted or closed. Once the air is exhaled, the diaphragm relaxes back to its resting position. The volume in the lungs will decrease, which will make the pressure inside the lungs increase. So this high pressure that's inside the lungs is going to want to become equalized by rushing to a place that is of lower pressure. So in this case, it would be the atmosphere. And so the pressure from the lungs is going to travel up the trachea and build below the level of the vocal folds, creating subglottic pressure. This subglottic pressure, once there is enough, the subglottic pressure is going to cause the vocal folds to burst open or abduct. And the next question you had was the necessary and sufficient conditions for phonation. And we know that we need a phonatory threshold, we need longitudinal tension, adduction of the vocal folds, and medial compression along the vocal folds for phonation to occur. So I'm going to go back to the nerve supply. So the nerve supply for the intrinsic muscles. So all of the intrinsic muscles portrayed by the yarn in this model are supplied by the recurrent laryngeal nerve, except for the thyroarytenoid muscle. The thyroarytenoid muscle is supplied by the superior laryngeal nerve. And then we were supposed to talk about the myoelastic theory of phonation. So when the vocal folds are adducted by the subglottic pressure, the vocal folds will come back together, causing the vibration. The vocal folds come together again during each vibration due to their elasticity, which is due to the fact that they're muscles, and the sudden pressure drop between the folds as air streams through the glottis, which is what causes phonation. And like I said, the elasticity is in reference to the muscles because they are elastic. The vocal folds vibrating back and forth very, very quickly with tiny puffs of air coming out. And this is what helps determine vibration of the vocal folds, which is the aerodynamic portion of the myoelastic theory. Now, the last thing you wanted us to discuss was the mucosal wave. And the wave of the vocal folds, because of the air pressure of the vocal folds, they're going to move in a wave-like motion. So the inferior part of the vocal folds are going to touch first, and then the superior part of them touching second. The mucosal wave is just the vibration of the vocal folds and the pattern they make when moving. And that was my larynx model. If you have any other questions, you can ask me, and thank you.